good afternoon. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. Now I am a budding YouTuber as well. So I am on my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally. In this discourse, every week I come up with discussions on the subjects of Ayurvedic psychotherapy, Ayurvedic psychiatry, mental health, and general psychotherapy and the related aspects. So, welcome to today's session. Today's session is a continuation session on my maternal mental health. That is, last week we had discussed about what is postpartum depression, how does it impact a mother and a child, what are the causes of postpartum depression, what are the symptoms of it, and how does Ayurveda approach postpartum depression. All these we had discussed in the last session. So in this session we are going to discuss the management part and the peripartum or the perinatal care part. We are discussing that as well today, because if we take antenatal and peripartum care, in most of the cases postpartum depression can be prevented. So this is very, very important. So we are discussing about that today, and we are discussing about some example case studies as well. So without wasting any time, let's get started. And before that, I was getting requests to do one-to-one mentoring on emotional metamorphosis, emotional intelligence, emotional freedom for various of your personal problems or mental health problems which are not very severe. And I am planning to start those sessions next week. So if you are interested, just mention that in the comments section that you are interested to enroll in one-to-one mentoring, or you can DM me on LinkedIn directly. So and I'm going to start those classes maybe from next week. These could be group sessions or these could be individual sessions. We'll decide based on the one-to-one first conversation that what is required in your case. This would be a customized approach. So let's see. Once we get all the enrollments, I will divide it into individual sessions and the group sessions. So without wasting time, let's get started on what is postpartum depression management and what is perinatal or postpartum care, and how do we do that. See, postpartum depression, as I said, is a complex mix of physical, emotional, and behavioral changes that happen in some women after giving birth. So we are going to know what happens in a postpartum depression cycle generally. See, there are some antenatal factors. That means postpartum depression can be influenced by factors during pregnancy, such as hormonal changes, personal history of depression, stress, and lack of social support. Social support may be here the family support, the support from the partner, the spouse, and support from siblings and friends. All these. So, and onset. See, postpartum depression typically manifests within the few weeks of after childbirth, but it can occur up to a year later. That means you are given a child the birth 1 year before and you are experiencing the symptoms now. So symptoms include, as we have discussed this in the last session itself, sadness, irritability, lack of interest in the baby, difficulty bonding with the baby, appetite changes, sleep disturbances, fatigue. That means constant feeling of tiredness, feelings of guilt and worthlessness, all these symptoms. So there are some negative cognitions also which are happening. That means women with postpartum depression, that is PPD, often experiences negative thought patterns such as self-doubt, self-criticism, and hopelessness. These thoughts contribute to the cycle of depression. The thoughts of self-doubt, self-criticism, worthlessness, hopelessness, all these contribute to these thoughts contribute to the cycle of depression. And the main thing we had discussed in the last session as well, impaired bonding. If you want, you can check my last session, or if you just type postpartum depression, if you can see in the playlist as well. You can go and check the video on both LinkedIn and YouTube. So impaired bonding. So impaired bonding here is no bonding with the child, and mother and child bond is impaired here. So postpartum depression can impact the mother-infant bond due to reduced interest. Either the mother is not interested in the interaction, either because of her self thoughts or self problems, or it may be because she is genuinely not interested in the baby, because of a number of reasons. Both might happen. This can lead to guilt and reinforcing negative thoughts. So, and what happens during this period is, we have already discussed this as well, reduced self-care. Postpartum depression can hinder self-care routines, that is which exacerbates physical and mental distress. The person does not take care of herself, so the mother. So the reduced self-care is also one of the symptoms. And isolation, that is, women with PPD might withdraw from social interactions, leading to further feelings of loneliness and depression. Women, with postpartum depression, they always avoid social interactions. They avoid social gatherings. They always want to be isolated, and or it could be because of the isolation. They don't have social support. It could be mutual. After the experiencing the symptoms, women might want to be isolated, but before that, before the experiencing of the symptoms, they might be ostracized, or they might not have got the family support or the support from the partner, from the father of the child, or support from the siblings, or support from the friends. So they feel isolated, and then they also want to be isolated because they feel self worthless. They always self doubt or self criticize or feel hopeless, and they want to be isolated. So what happens? The impact is on the daily functioning. So PPD can affect a woman's ability to perform daily tasks, creating a sense of inadequacy and reinforcing negative self-perceptions. So she is not capable of completing or completing her daily routine or daily functioning. It is impacting her daily life. Further, what happens is this creates further negative thoughts in the sense of inadequacy or reinforcing negative self-perceptions on these things. So then we talk about then comes the therapeutic approach for that. Counseling and psychotherapy, medication, support groups, family involvement, group therapies, lifestyle changes, all these things. So we'll discuss therapy, the talk therapy, or counseling, or different types of psychotherapy is mostly the beneficial part when it comes to postpartum depression. So cognitive behavioral therapy, CBT, which I practice, helps women identify and challenge negative thought patterns, develop coping strategies, and improve self-esteem. The first thing is psychotherapy and counseling sessions. In severe cases, maybe there might be some medication required. Anyway, we are not prescribing or talking about any medications here. So support groups, connecting with other women experiencing the same issue, that is postpartum depression, helps reduce the feelings of isolation and provides a safe space for sharing. And family involvement, that is educating family members, to educate family members about there is some condition called postpartum depression, and this can be better if the mother gets the support from the family, the extended family, the spouse, and friends, etc., friends, colleagues, etc. And lifestyle changes. See, a balanced diet, uh, exercise regime, and a proper sleep. All these three things are really important, and these play a significant role in managing postpartum depression. So I'll go through some of the case studies. Yes, we have some case studies here that to what all patient, women can approach for postpartum depression. See, our first patient here is, or the client here is Vanilla. Vanilla is 28 years old. She experiences postpartum depression with her first child. She's the first time mom, and she experiences postpartum depression. But she had a previous history of anxiety. So that is the reason she had developed postpartum depression and all the related symptoms we had discussed in the last session. So this case is regarding like a history of mental health disorder. When we discussed some of the causes of postpartum depression, this is one of the cause, a history of another mental health disorder. So what happens is when she approaches us for psychotherapy, so she receives cognitive behavioral therapy, and slowly after she receives some certain psychotherapy, with the support groups, with the support of the family, we counsel her family members as well, her spouse, her in-laws, her parents, her siblings. Then she regains the confidence, and this improved her overall health and the bond with the baby. This is a type of, this is one example. And the second example here, let's consider this client as Strawberry. So Strawberry developed postpartum depression after traumatic childbirth experience. I had said while mentioning the cause, this is a cause as well. Traumatic childbirth experience. That means that she had to go through pregnancy complications here in this case, and she developed postpartum depression having after giving birth. So she also underwent, psychotherapy, and her birth-related trauma and was addressed here, and was her negative thoughts were balanced, were replaced, reconstructing was done, reconstructing of her negative thoughts was done, and gradually her feelings of guilt and anxiety lessened. She was put into support groups, and we counseled her. Her family members were also counseled, and with all these support, she improved. This is the second cause. I am just telling about the causes. Postpartum depression can occur due to different causes. I'm explaining on different causes. Here, let us consider our third client as Marigold. See, Marigold, is 25 years old. See, she developed postpartum depression because she faced a cultural stigma around, and she developed it because of the not so good environment from the partner's place, that is her in-laws, and there was a cultural stigma which was around, and then she started seeking help for postpartum depression. So with the support of psychotherapy, with the support of her spouse, with the support of group therapies in the support groups, with everything, started learning coping strategies and techniques to manage her postpartum depression. With her, whatever her cultural context was also there. That means I think her husband was from another culture, and this was a cultural stigma concept. Then all this improved her, overall mental health and the bonding with the child as well. These are the examples that how, different circumstances can cause postpartum depression in mothers, newborn mothers. See, here, when we talk of postpartum depression, what should we do to prevent postpartum depression? That is a major thing we have to consider, because prevention is always better than cure, right? So, an ounce of prevention is better than kilos of cure. So, I had heard this quote somewhere, so it just clicked my mind. So, perinatal mental health plays a crucial role in preventing and addressing postpartum depression. So, perinatal mental health. See, perinatal mental health is 3 months after she starts, and the or first from the first trimester till she gives a birth. That period is called a perinatal period. So, in that period, that perinatal mental health care is really important. That is, before giving birth, the support from the family, the support from the partner is really important. The support from the friends or colleagues is really important for a mother to, not prevent from postpartum depression. The perinatal mental health focuses on the emotional well-being of the individual. I think during pregnancy and the postpartum period, encompassing the time from the conception to the first year after childbirth. Here they are considering from the conception to the first year of the childbirth. It's also usually it is after first trimester. Now in some books it is also mentioned as from the time of conception to the first year after the childbirth. So here screening, what is done, screening and early detection. See, perinatal mental health professional including obstetricians, who all come under here: obstetrician, midwives, mental health providers often screen pregnant individuals for risk factors and symptoms of mental health conditions. This screening is also done, including depression. Early detection allows timely intervention and support before symptoms escalate into PPD. See, if there is early detection of the mental health of the mother, that is, maternal mental health is very much important, as you can see in my background. See, maternal mental health is, plays an important role if that screening and early detection is, if it is done, then the symptoms can be prevented, and postpartum depression can be prevented. So, education and awareness. So, perinatal mental health program. See, a mother and her family, a to-be mother in the prenatal period, or to-be mother and her family should also know about what is perinatal mental health. So awareness is really important. So and they must also know about, there is a condition called postpartum depression. So if they are well informed and well educated about postpartum depression, what happens is it can be prevented, because preventive measures and strategies can be taken before escalating into PPD. See here, perinatal mental health programs and resources provide education and information to expectant mothers, the parents, about the potential emotional challenges they might face during pregnancy and postpartum. Raising awareness about the signs and symptoms of postpartum depression, it helps individuals recognize the condition and seek help. So will be if the mother and the family is well informed or well educated, they can about the condition, it helps in recognizing the condition if there is some, and seeking help at the right time before the onset. Risk assessment and prevention strategies. So Perinatal mental health experts assess the risk factors, what all might happen, and that may contribute to postpartum depression, such as a history of depression, lack of social support, stressful life events, or hormonal fluctuations. See, the circumstances for every to be mother is not the same. So there are some risk factors. You may say that I have not experienced these. It doesn't mean that the other person who is going to be a mother is not experiencing these. So there may be lack of social support. There may be stressful life events. There may be hormonal fluctuations. Based on these assessments, tailored prevention strategies can be developed, such as creating a strong support network, practicing stress reduction techniques, planning of self-care and routines, etc. So, and all this comes under emotional preparation. So, perinatal mental health professional helps individuals and couples prepare emotionally for the changes that come with parenthood. So this includes addressing fears, expectations, concerns, ambiguities. To be mothers and the first time mothers have so many doubts. What's right for the child? What's not right? What to eat? What to eat? What not to eat? Do's and don'ts. Everything. This also creates a sense of the sense of ambiguity and feeling overwhelmed, or is also, we have to emotionally prepare for all. If we know about the condition, we can emotionally prepare before giving birth. So anticipatory guidance. Professional in perinatal mental health provide anticipatory. See here, anticipatory guidance is if there are chances of developing postpartum depression in a mother, then they will give you, the mental health professionals in that time, they will give you strategies and guidance to prevent, or to be equipped. Professionals in perinatal mental health provide anticipatory guidance, equipping expectant parents with coping skills, management techniques, and communication strategies that can help them navigate the challenges of new parenthood and be more effective. So, supportive interventions. Yes, supportive interventions here is, perinatal mental health practitioners. There are practitioners who practice perinatal mental health offer supportive interventions to address mild mood disturbances early on. There may have many challenges, in pregnancy. So there may be mood disturbances in the early pregnancies as well, preventing them from escalating into full-blown PPD. Here, these interventions might include counseling, support groups, and psychoeducation. That is basically awareness. Partner and family involvement. Here, as I said, partner and family involvement is most, crucial. So, involving partners and family members in perinatal mental health support can strengthen the individual's social support network. So, educating partners about perinatal mental health and fostering open communication. So, that can create a more understanding and supportive environment. So, postpartum planning. All these we have talked about peripartum. Now we are talking about postpartum planning. That is planning, what all, strategies to be, or to be considered, after birth, that you are planning earlier. So postpartum planning. Perinatal mental health professionals assist individuals in creating postpartum plans that outline their support systems. So self-care strategies, or the potentials, addressing the, creating awareness and addressing the potential challenges they're going to face. A well-prepared plan can help individuals feel more confident and empowered during the postpartum period. So continuity of care, and after, postpartum, after the childbirth as well, there should be continuity of care. Continuity of care is perinatal mental health care doesn't end with childbirth. Continuity of care ensures that individuals receive ongoing support as they transition into the postpartum period. So this can involve regular check-ins, therapy sessions, and adjusting interventions as needed. So by focusing on perinatal mental health, individuals can proactively address emotional challenges, receive the necessary support, whatever the support is necessary, and reduce the likelihood and developing severe form of postpartum depression. We had also discussed about postpartum psychosis. That is the severe form of postpartum depression. One of the severe forms. So it is a comprehensive approach that recognizes the importance of emotional well-being. So everything must be considered. And then see what all is involved. Now we are discussing what all is involved in managing. Till now we discussed what all the perinatal care, that means from the time of conception to childbirth, and also the support, then also it should extend. We had discussed about this. Now we are discussing about managing postpartum depression. That means a mother has already developed postpartum depression. So how to manage that? So this also involves a comprehensive approach. What that means physically, if there are physical symptoms, that should be addressed. If there are emotional symptoms or emotional concerns, that should be addressed. If there are any psychological or mental health conditions, prior mental health conditions, that needs to be addressed here for the holistic well-being of the mother and the child. It's important to consult a healthcare professionals at this period. See, so what is done in the beginning? What do we do? Medically, we assess a patient. A healthcare provider will conduct a thorough assessment to diagnose the severity of postpartum depression. Is it mild, moderate, or severe? The severity or the intensity of the postpartum depression. So these may include physical examination, blood tests, history taking, and detailed history taking, and discussions about the mother's symptoms and medical history. Next is after the assessment, after the medical assessment, what is done? Therapy and counseling. So talk therapy and psychotherapy play crucial roles in treatment of postpartum depression by providing a supportive and therapeutic environment for women to address their emotional struggles. See, I had told this earlier as well. But if a person or a mother or in general a person starts sharing his concerns, his or her concerns to a psychotherapist or a mental health professional, that minute only the recovery starts. That means he or she is putting all the mental clutter out. So the first therapy, we are now going to discuss what all therapies are used in treating postpartum depression with minute examples. So cognitive behavioral therapy. Cognitive behavioral therapy is one of the most effective forms of psychotherapy for postpartum depression. It focuses on identifying and modifying negative thought patterns and behaviors contributing to depression. So thought identification. What do we do here? Thought identification. Women learn to recognize distorted, and negative thoughts about themselves, their baby, and their abilities as a mother, that they are capable. And challenging beliefs. Therapists guide clients to challenge these negative beliefs. Whatever the negative beliefs are there, first the therapist will know all of them. We may tell them to, there are many cognitive exercises, mindfulness practices, journaling. We may tell to do certain activities for them to analyze their abilities as a mother. See, and to challenge their negative thoughts, that these thoughts are in your mind and they're unrealistic thoughts, by examining evidence. So here as I said, in cognitive behavioral therapy, it helps to identify negative thoughts, patterns, and behaviors and replace them with healthier ones. So healthier thoughts, healthier behaviors. In the context of your postpartum depression, it can help to recognize distorted beliefs and develop more realistic perceptions of their abilities as mothers, and to give realistic goals, to keep realistic goals. Example, a therapist might work with a new mother experiencing postpartum depression to challenge the belief that there is a belief of the mother that she is a bad mother, and due to that belief, she is constantly having negative thoughts, and she constantly feels she is worthless and hopeless and always tired. And because she's struggling with certain aspects of parenting, so all these aspects of parenting and the unrealistic and challenges, unrealistic negative beliefs are challenged, and then she is treated in that way by cognitive behavioral therapy, by giving them exercises and changing the beliefs. So, and interpersonal therapy, interpersonal therapy is also a form of psychotherapy. What it does is it improves interpersonal relationships and communication skills. That means, it's often used in postpartum depression to address issues related to new mother's role and identity, as well as the changes in the relationship with the partners, families, and friends. All these are discussed. A woman with postpartum depression might work with her therapist to navigate the changes in her relationship with the partners. As soon as the child is born, there are some changes which a mother experiences with her partner as well. So, yeah, and to adjust, and so for that she might feel that she is a hopeless wife, or she's not a worthy wife, or all these things also may lead to postpartum depression. So these things can be improved by interpersonal psychotherapy therapy, because it encourages them to communicate and share their concerns with their partners and family members. And next is psychodynamic psychotherapy. So this therapy explores, unconscious processes. That means past experiences, unresolved conflicts. Suppose there is a unresolved conflict with the partner or the family members, or there is some negative past experience. If if the mother has some of these, then she may develop postpartum depression. So to address these underlying issues, we use psychodynamic psychotherapy. A therapist might help a woman with PPD, any unresolved feelings or conflicts related to her own childhood experiences Now, she might have experienced any childhood abuse or any bad events which might lead to, sometimes we had discussed about post-traumatic stress disorder. See, post-traumatic stress disorder can also result in postpartum depression. So what we do next, what we use is mindfulness based therapies. There are some mindfulness based therapies. These also come under cognitive therapy, and these therapies teaches the mother to be in the present moment without any judgment. So self judgment should be avoided. That is taught in these sessions. This can be helpful for managing the overwhelming emotions that often accompany postpartum depression. It is, see, people may not experience or have the same feelings or the same symptoms. It is individual. If it is different for different individuals, so different combinations of therapies are also used for different individuals. A therapist might guide a woman through mindfulness exercises to help her stay present and manage her anxiety if it is associated with anxiety or stress. If postpartum depression is associated with any mental health disorders, these can also be addressed by mindfulness based therapies. And next is supportive therapy. As I said, supportive therapy provides a safe space for the mother to express their feelings, fears, challenges associated with the motherhood. There are many challenges, fears, ambiguities. I said as as any mother experiences, but in this case it is severe. So they can, all those things are addressed, because in the support therapy you will have people with mothers with different mothers with the same disorder, and when you share your concerns, when you hear other people's concerns and how they are recovering, it gives you a sense of support, and you feel you're not isolated. A therapist might listen empathetically to a woman's struggles with sleep deprivation and feelings of adequacy. Sometimes what happens is, just if a person listens to you, half of your problems come down. So listening, and if you could do it with your family as well, if you have a supportive family as well, if that family or the partner or the mother or mother-in-law, whoever, or siblings or other family members, if they hear to the mother's concerns, most of the times the concerns come down. Next is group therapy. Group therapy is the same as, in support therapy only, it comes under the group therapy. That means it involves sessions with small group of women who are experiencing similar challenges. It provides a sense of community, reduces isolation, and allows participants to share their experience and coping strategies. So this, and then one more thing is family therapy. The family therapy involves the women, to women's partner or family members, and focuses on improving communication and understanding. First the awareness, the education, then the communication and the understanding within the family unit, which can be, which can improve, which can help to manage postpartum depression. A family therapy session might help the women, the mother and her partner, communicate their needs and concerns regarding the parenting responsibilities and emotional support. When a child is a responsibility, so sharing the responsibility also is very important, and that concerns, as to address that concerns, is also important. All these are, in this way, um, it is managed in a holistic way, in a comprehensive way. In Ayurveda as well, the postpartum period is called Sutika Avastha. It is considered crucial for a mother's well-being, and it emphasizes on balanced diet, a lifestyle, and some herbal remedies, and some herbal, and some therapies, to promote both physical and mental health of the mother, a new mother. So, um, in Ayurveda, we had discussed in the previous session that what all we do, that sattvic diet, rest and relaxation, emotional support, herbal remedies, soothing aromas, meditation and pranayama, avoiding negative influences, emotional support, everything. So all these things collectively, one thing is that if a mother is supported well during the pregnancy, the whole pregnancy, to certain extent, postpartum depression and baby blues can be prevented. So this is very crucial. So this brings us to the end of the session, the maternal mental health, and I'll come up with a new topic in the next session. And people have asked me about, last week I got a question on postpartum depression in men. Yes, men also experience some men also experience postpartum depression, but however the intensity and the symptoms are a bit different. So mostly affected are the mothers, the new mothers. So we discussed it in detail for mothers. I'll come up with postpartum depression in men. Men also, few percent of men also experience postpartum depression. I will come up with that as well in some other later sessions. So mainly the women are impacted here. So maternal mental health is discussed because the intensity, and the mother has to go through many changes in the pregnancy and childbirth. So, maternal mental health is usually discussed much. We shall also discuss about paternal mental health in some other session. So, thank you for staying tuned. And if you have, feel free to share your thoughts in the comment section. So, thank you. Namaste.